Welcome to Cleveland Regional Medical Center. This is the Women's Life Center here at the hospital. My name is Kristy Turner. I'm a labor and delivery nurse, and I've been here for 11 years.
And I'm Michelle Barr, one of the assistant directors for labor and delivery and OB. And we're going to take you on a tour.
This is the area that your family would typically wait during your labor process, like right at the birthing part. They can be in and out throughout, but right now this is where they'd wait. And we'd come get them after the baby's born and all the excitement. There's plenty of TVs to watch, and there's a little area for children once children are allowed back in. Right now, with the flu season, they're not allowed in for right now. Okay, we're going to go and we're going to start off through the hallway and show you exactly how to get into labor and delivery. This is the entrance to labor and delivery. Sometimes these doors might be locked. If they are locked, all you have to do is there's a code right here on the wall. You just pick up the phone and dial the number, and it dials directly to the nurse's station, and we will open the door for you. But majority of the time, all you got to do is push really hard.
We have 3 observation rooms on this side of the hallway, which right now do have patients in them, so we can't walk you through one of those. But typically when you come in, the first thing we do is put you in an observation room and put you on the monitors to see what your contractions are doing and your fetal heart rate, and kind of find out what's going on with you. And then once we deem that you're in active labor, then we move you over to a labor room. So we'll go in one of those now. This is the nursing station where the nurses hang out.
This area over this way is for our families. There's an ice machine, there's cups, there's a refrigerator that you could put your extra food in if you need to. There's a coffee machine, and we'll assist you in any way that you might need to make sure that you're comfortable as the family members. Mostly the patients can't have any of it, so it's just mainly for the family.
These are all labor rooms on this side of the hallway. We have 8 labor rooms total.
Just going to kind of go over and explain the difference between the rooms. The observation rooms, typically you come in through the ER through patient registration, and we send you into an observation room. We have you get undressed. We hook you up to some monitors. One monitor, which they work the same in the rooms, one monitor will go on the top of your belly. It monitors contractions. The next monitor will have some gel on it. It will go typically on the bottom of your belly, and it measures fetal heart rate so that we can see it. We have computers in each room, and the computers show us at the desk what the baby's doing at all times and your contraction pattern. You typically stay in an observation room until your water's broke, until your contractions have changed your cervix and you're at least 4 centimeters dilated, or that the doctor deems that you need to be moved over. Okay, this is, I don't know if you can see it, but what we're talking about, it shows up out there. It has your contractions, which are the bottom, and it'll show on the monitor the same. You'll have contractions, and then this would be your baby's heartbeat, this on the top. Okay.
And the nurses do continuously monitor at the desk. They can see all of the monitor strips in every room at the nursing station. So somebody somewhere is always monitoring what's going on with you and your baby.
And this is the kind of monitor that you'll see in your room. This will be the heartbeat, and these down here would be the contractions. At any time, if there's any type of problem, we see this at the desk, and as you see this little red thing that's alerting, it alerts the nurse's station, and it alerts any nurse that's out there. There's always a nurse watching this monitor no matter what. So if something happens with baby, heart rate drops down, you're liable to see 2 or 3 nurses come in here all at once to make sure you and your baby are safe.
And we do at times, if we're all in a room doing a delivery, we will pull up all the patients on your screen. So if you look over and happen to see more than one monitor strip, sometimes patients will say, you know, what is all those other monitors, what's going on? But it's just the other patients, because we want to make sure that we're always watching them. And some of the things that we may use during labor that you may see, if the physician or the midwife decides that they need to break your water to try to kind of speed things up, this is called an amni hook, and you can see it's kind of hooked like a crochet hook on the end, and basically the midwife or the physician uses this, they insert it vaginally, and they're able to break your bag of waters. Another thing that they may, you may see used, this is called an IUPC. It stands for an intrauterine pressure catheter. Basically what this is used for is it's inserted also vaginally. It's placed between the fetal head and the outside wall of or the inside wall of the uterine cavity. And when the uterus contracts, it presses and squeezes up against the baby's head, which in turn gives it a pressure reading that we can read on the monitor. These are used a lot of times if you are being induced and we're giving you medicine to stimulate contractions. We want to be sure that we're not causing your uterus to contract too hard or too often, and we want to make sure that we're able to monitor it really, really accurately. This is a fetal scalp electrode. Basically what this is used for is to monitor the baby's heartbeat. Sometimes with the external monitors, we're not able to get an accurate reading. If the baby's moving a whole lot, sometimes we have a hard time keeping it traced. So we may put one of these on. Basically this is inserted and placed up against the baby's head. It's just a tiny little wire. It doesn't harm the baby in any way, but it does attach to their scalp. Just barely underneath the scalp, and it gives us an accurate fetal heart rate, and so we're able to trace those.
And this can be placed by the doctor or midwife or the RN. At delivery, so you've been in here, pain management wise, we have several options. We have the tubs that have the jets in it, and as long as you meet the criteria for that, you can get in the tub. A lot of people say that it takes the pressure away, and they like relaxing in the tub. Another option is we have birthing balls that you're able to rock on and kind of bounce on a little bit. We do allow ambulation as long as it's okay with the doctor. We have IV pain medicine. We typically use Stadol, is what we typically use. You're allowed to have that as often as the doctor orders it, and as long as it's not too close to delivery, because we don't want to hurt the baby in any way by making it not being able to breathe a little bit. The other option is epidurals. Epidurals around Cleveland Regional, how it works is you make sure, if you're planning on having an epidural, to get on the list. And what you need to do is watch a video by Shelby Anesthesia and make sure that you've signed consents. And the reason that they do that, they want to make sure that you're informally consented prior to giving it to you. And if it's your first baby, you've probably never really endured pain, so it's a good way to make sure that you've gotten on the list. We do not make you take it. It's totally up to you. And if it's not your first baby, every pregnancy is different. So option-wise, probably the wisest thing might be to get on the list just to make sure, but we would never, ever make you take it if you did not want it. Health department has classes that they arrange for you. They set it up during your visits, and if not, you can always ask over there. But then if you cannot get that way, Shelby Anesthesia, which is located right on, is it Washington, or right there on right as you're coming into the ER, and you can call them and they could set you up with the video that you have to watch. Okay. These are our birthing tubs, and the way they work, well, it's not really a birthing tub, it's just a relaxation tub, and the way it works is it has jets in it.
This is a kind of layout sofa that we do. We'll provide pillows and blankets and sheets for whoever the person is that's going to be staying with you. Sometimes we have patients that come in and they have to stay overnight for possible, if they're going to be induced in the morning, they may have them go ahead and come in at 5 the night before. We do allow one person to come in and stay with you overnight. We try to limit visitors to 3 people in the room at a time. We have that big waiting room that you saw out there that we really encourage your family and friends to use, because it can get quite overwhelming in here if you get more people than 3. We also do that for safety reasons, because our main focus is mom and baby, and you never know when something may or could go wrong, and at that time we want to be sure that we can get and have easy access to mom and baby without having to jump over a whole bunch of visitors.